Pathogenesis of Canine Spirocercosis or Spirocerca lupi infection. Spirocerca lupi is considered one of the deadliest parasites of canids, particularly in dogs. It kills the dog silently as it is associated with the production of many pathological conditions. So the major pathological significance of canine spirocercosis is Barminous aneurysm and esophageal granuloma formation. Later, this esophageal granuloma may convert into osteosarcoma. So how these lesions are produced, we'll discuss here. For the better understanding of this pathogenesis, you need to understand the life cycle of the parasite that I have already discussed. So damage of the endothelium of the thoracic aorta and its branches are caused by the larval stages, that is by L4 stages. As a result, there will be arteritis or endarteritis followed by necrosis and fibrous scar tissue formation. So due to thickening of the arterial wall plus deposition of the parasitic masses causes progressive dilatation of the arterial wall. This condition is known as Barminous aneurysm. So if there is rupture of the vessel, affected dog will die suddenly. So in this picture, you can see the aortic lesion. So in the first image shows the lesion in the inner surfaces of the aorta, and in the second image shows lesion in the outer surfaces of the aorta. So these lesions are the consequences of the larval damages to the wall of the aorta. So due to the endarteritis or arteritis, thromboemboli will be formed, and this is associated with many conditions. For example, if this thromboemboli block the coronary artery, that will result myocardial infarction, resulting death of the animal. However, degenerative changes of the elastic fiber of the tunica media also associated with the progressive dilatation of the arterial wall, leading to formation of Barminous aneurysm. So nodule in the wall of the stomach can also be developed by the L3 stages and its migration with the wall of the stomach. So damage is caused by the adult parasite. Esophageal granuloma will be formed due to the inflammatory reaction towards the parasite and their secretions. So over the time, this esophageal granuloma become large, pedunculated, resulting dysphagia, that is difficulty in swallowing. So due to regurgitation, vomition, and accumulation of food in the esophagus may contribute to the aspiration pneumonia, leading to severe consequences, even death of the animal. Next, due to the rupture of the esophageal granuloma, esophageal content will come to the thoracic cavity and the dog will die due to severe pruritus. Rupture of the esophageal granuloma may also contribute to anemia and pyemic nephritis. Some of the rare or less commonly occurred complications include development of osteosarcoma, from esophageal granuloma, spondylosis of the thoracic vertebrae, and salivary gland enlargement. So esophageal nodule formations during Spirocerca lupi infection progress from early inflammatory to pre-neoplastic, even neoplastic conditions. So the first two forms, that is stage 1 and stage 2 of the esophageal granuloma, is non-neoplastic in nature. Histologically, early inflammatory stages contain mostly fibroblast and large amount of collagen, whereas proliferating fibroblast, reduced amount of collagen, along with numerous amount of multinucleated cells are seen in preneoplastic conditions or in preneoplastic nodule. So over the time, 25% of these esophageal nodules undergo neoplastic transformation with subsequent metastasis to various organs such as lungs, lymph nodes, etc. So in neoplastic form, spindle-shaped cells, mineralized bones, and osteoblasts are predominant. So these photos are taken from a paper on pathological alteration in dog resulting from parasitism by Spirocerca lupi. So in this photo, you can see numerous worm in the esophageal nodule after longitudinal section of the esophagus during post-mortem examination. This is the histological section of the esophageal granuloma, showing that parasites are surrounded by inflammatory exudates and fibroblasts. Next, this picture demonstrated the stomach nodule formation, which is around 2 cm in diameter. It may be resulted due to the migration of L3 stages in the wall of the stomach. Next, this picture revealed the formation of mineralized matrix, which indicated the transformation of esophageal granuloma into osteosarcoma. This parasite can aberrantly found in different organs of the final host. So this particular figure shows swollen kidney with infarction in the medulla resulting from aortic thromboemboli. And in this picture, you can see splenomegaly, several points of capsular rupture, and an extensive area of infarction in spleen due to aortic thromboembolism.